Welcome to this lecture. Today we will discuss OTC drugs, over the counter drugs. OTC drugs are very common in Indian market because Indian patient does not go to doctor, he doesn't take consultancy of doctor, directly go to the pharmacy and practitioner and buy medicines from there. Indian patient believe in self medication, in self diagnosis. They try to find out what are the different causes of disease and they prefer self medication. But for some extent it's safe, but sometimes in few patients the critical side effects are noticed by the physicians. So in this lecture we will discuss OTC drugs, over the counter medicines. Examples are Vicks, acetaminophen, crocin, ibuprofen, brufen, combiflame, birth control pills like Maladi. These are the commonly used drug. In special cases, we must take consult from physician in case of birth control pills like Maladi. If we are using over the counter drugs, we must follow certain precautions. Carefully read and follow the direction on the bottle of medicines. Take the minimum effective dose. Call your doctor in case of symptoms. Don't take medication if you have prior history of allergy. OTC are those drugs which are safe and effective for the use by the general public without need of doctor prescription. These drugs are non-prescription or over-the-counter drugs. There are certain drugs like narcotics and certain antibiotics which come under the Schedule H. These drugs only can sell by the pharmacist on prescription. These have little significance pharmacological activity and therefore physician not need to take much concern about this drugs. Significance comparatively cheaper, an increased trend for self-care and increased tendency of the patient to maintain their own health. Chemist himself may prescribe OTC drugs. OTC consider as a time-saving medication, so patient don't want to spend much time on the physician's clinic, lesser number of side effects compared to the prescription medication. Now there are some information which is present on the OTC medication label. Label contain name of active ingredients, name of product, indications, precautions, warnings, directions, instructions, and other information, address of the manufacturer, and any comment about medicine. OTC drugs labeling is regulated by Food and Drug Administration (FDA), and advertisement is regulated by FTC, Federal Trade Commission. Prescription drugs advertising is strictly regulated by FDA. Medication will fall into three categories: prescription only medication, POM, pharmacy only medication, behind the counter, and general sell list. What are the possible risks associated with self medication or OTC drugs? Inaccurate diagnosis, delay in obtaining needed therapy, use of suboptimal therapy, drug resistance, increased cost of patient, failure to follow label instruction, it causes adverse effect and drug interactions, perceived loss of control by physicians. In certain worst condition, the patient must take the advice of doctor because physician has brief knowledge of medical field, so he knows about drug interactions and drug food interaction and drug disease interaction. Already you have a major disease, in this case you should not do self medication because sometimes it is life threatening. If we talk about analysis of Indian market, the 55% of OTC drug and 45% is prescription drugs. Over the counter drugs products account for 55% of drugs used by Indians. Now, types of OTC medicines. These are the categories: analgesics, antibiotics, cough suppressant, anti-acne drugs, analgesics, NSAIDs category drugs, antiseptics, decongestants, antacids, antifungal drugs, histamines drugs, anti-allergic. Now, what are the topical antibiotics? Only topical application antibiotics come under OTC category. For oral administration and injections are not come in this category. Topical antibiotics are the medicines applied to the skin that kill the bacteria. They are used to prevent infection that occur in minor cuts, scrapes, and burns due to presence of bacteria. Cough suppressant. Cough suppressants are the medicine that prevent and stop the coughing. A cough suppressant is used for treatment of dry cough. These drugs are anti-tissue agents. It helps in suppress the body urge to cough, and it suppress the cough, and it releases and liquefy the cough so it comes out easily. For this purpose, we use expectorants. It helps to expel out the cough from respiratory tract. Anti-acne drugs. Anti-acne drugs are the medicine which is used in treatment of various acne problems like pimples, whiteheads, blackheads, and other serious form of acne. Non-steroidal anti-inflammatory drugs. These are analgesics. It work on the peripheral nervous system, and this is used to treat the inflammation, reduce the fever, for antipyretic effect, and loss of sensation of pain for some time. Like crocin and anacin, it is used for headache very commonly. Antiseptic medications. Antiseptics is a form of lotion, cream, ointments. This medicine slow down the growth of germs and bacteria, and it inhibit the further extension of infection. Analgesic drugs. Analgesics are the medicines that relieve from pain. Decongestants are the drugs which is used to relieve the nasal congestion, which is very common term, refers to the stuffy nose. Antacids are the medicines or the drugs which neutralize the stomach acid. Antihistamines are anti-allergic drugs which is used for sneezing, itchy eye, runny nose, and other kind of allergies. Antifungal drugs, this is used in the treatment of fungal infection. Smoking, smoking cessation drugs, these are the medicine which is used to prevent people or stop people from smoking or using cigarette or tobacco. Smoking cessation drugs. Now the label contain following information: the name of product, identity of product, active ingredient, quantity, manufacturer name, how to use the products, instructions, and possible drug interactions, and when drug should not no longer use, expiry date and date of manufacturing. Rules for the proper use of OTC drugs: always know about what you are taking, know the benefits and side effects of the drug, read and heed the warning and cautions. Don't use anything for more than 1 to 2 weeks because it produces drug dependence. Be particularly caution if you are taking prescription drugs. If you have question, ask to pharmacist or physician. If you don't need it, don't use it. Special patients should must take care of OTC medicines like child, pregnant women, lactating women, geriatric patients. In this case, the self medication is not appropriate. OTC medication are safe but for some extent, but in some cases it causes risk. As with all medication, This can be used with other medication, delay in seeking medical advice for the serious illness, risk of drug and drug diet interaction, risk of adverse effect, and potential drug dependence and misuse and drug abuse is also common with OTC. So, for some extent, the self medication is good. Otherwise, you must take advice from good physician, your family doctor, and after consultation, you buy the medicines, because medicines are not vegetables. These are not health supplements. The active ingredients of medicine part can treat or cure your disease. So please like and subscribe the channel, and thanks for watching this video.